Hello everyone. I'm Dr. Veena Aggarwal, MD MEDTalks and Trustee Heartcare Foundation of India. You're watching Dr. KK's MEDTalks, non-stop 407th episode today. Let's have the headlines of the day. India's first mRNA-based COVID-19 vaccine candidate by Genova Biopharmaceuticals has been granted approval for phase 2 and phase 3 clinical trials. COVID-19 in India may be entering into a stage of endemicity where there is low or moderate level of transmission going on, said the WHO chief scientist Dr. Soumya Swaminathan. 16 Afghanistan evacuees out of the 78 that landed in India yesterday are COVID positive. As a measure of precaution, all 78 have been quarantined. After the festive week of Onam, Kerala woke up to the grim aftermath as daily cases of COVID 19 shot up to a near 3-month high of 24,296 on Tuesday. The massive surge pushed the national count of fresh cases past the 37,000 mark again after 11 days. The Ministry of Health and Family Welfare has introduced a new facility to book COVID 19 vaccine slots via MyGov Corona Help Desk on WhatsApp now. Let's go to the topic of the day. A very common concern amongst all of us today is it safe to visit the dentist now? And even though most of us dread the dental chair, the pain of a cavity or the desire to correct our smiles with dentures drives us to the dental clinic. But once there, we have to take off our masks and open our mouths with the possibility of direct invasion of the COVID virus. So, how do we take care of ourselves so as to avoid catching the deadly virus on such visits? Also, how do dentists protect themselves from getting infected by such close contact of a potential carrier patient? To answer all these concerns and discuss more on this topic, we have with us today Dr. Radhika Sahni. Dr. Sahni is the director. Hi, Dr. Radhika.
Hi, Dr. Veena Aggarwal. Thank you for having me here tonight.
Pleasure. So, Dr. Radhika is a dentist and she's a senior prosthodontist and implantologist certified by the American Academy of Implant Dentistry in implantology and advanced implantology procedures. Dr. Radhika is one of the first leading practitioners in digitally navigated keyhole surgical implant system and is one of the very few dentists in India who has a fellowship in orofacial pain and sleep apnea from Smile USA in association with Roseman University. But above all this, she's not only a dear friend, but my dentist for life. And that speaks a lot for her professional skills. I have a long history of running away from the dental chair many times. Welcome to our show, Dr. Radhika.
Thank you, Dr. Veena. Thank you so much.
So, charity begins at home. So, let's start with you. Do you feel safe practicing in this pandemic? What are the major concerns you have? And what changes have you had to make in your day-to-day practice?
So, Dr. Veena, it's been a very difficult time for the dentists. We are actually the only people or only practitioners who are directly meeting the patient without any face masks. It becomes very difficult for us because you do not know if there is any patient who's asymptomatic sitting on the chair. And we not only expose ourselves, but our other staff or the staff working alongside with us to various such viruses. Dentistry has always been a little more difficult in relation to us being exposed to viruses or bacteria directly through a patient's mouth, but more so now. We've taken a lot of steps towards making sure that every patient who comes into the clinic is safe, the people who are working within the clinic are safe, and that dentistry can carry on because there are a lot of dental emergencies that a patient can go through. And these are procedures that sometimes cannot wait. Due to a long haul COVID, there are a lot of patients who are coming to us with pain and neglect, which has been going on for over 2 years now. And we have no option but to take in such patients and to manage them. So some of the few steps that we have taken is number one, we've reduced the number of staff. So the number of doctors that are coming in and the number of staff that we have been drastically reduced so that we reduce the number of people who are being exposed to one another. We have limited and we are strictly now seeing patients only by appointments. So you will not find anybody sitting at the reception area unless and until it's an emergency that we need to tackle. We are now avoiding people coming in with the patients. So, a lot of times, because people are so scared of dentists, they want to come in with their mothers or their wives or their children or, some assistant who is alongside with them. So unless and until it's a small child or an adult that really needs an assistant, we don't really allow assistants inside the dental clinic anymore. Of course, like I said, the number of patients that we are seeing in a day have drastically reduced because we are only seeing one patient at a time. The kind of hygiene and the sterilization that we are keeping in between the patients has also highly increased. A patient has a protocol that he needs to follow before he enters the dental clinic. Once on the dental chair, practices like ours, which only have 2 chairs in the dental practice, we are only using 1 chair at a time. So once we finish seeing an appointment on chair 1, we close the room for 15 minutes for sterilization or fumigation and see the patient in room number 2 and vice versa. So there are a lot of steps that we have taken to make sure that nobody is exposed to COVID-19 virus when he's visiting our clinic, or to take care that none of the staff is really affected with COVID virus.
So, dental procedures are often associated with aerosol generation, which is a mode of transmission of the COVID virus too. So, do you have
Yes.
specific air filtrations or something in place to deal with this problem?
Yes, we do. We have very good air purifiers to deal with this problem. And that is why in between patients, we close the room and we fumigate the room. So whatever virus is settling down on the surfaces, on the floor, on the dental chair, they are all getting fumigated by sodium hypochlorite.
Right. And how safe is it for patients to start visiting a doctor's clinic now, dental clinic now, or should they do
See,
only
as of
emergency procedures?
now, no, as of now, because the cases are really low, this is the best time to visit a dental clinic and to get your dental work done.
So,
And I
can
think a
poor
lot of good dental practices are taking care that, there's no overlap of patients and there is enough patient care and hygiene care that is being taken.
and how important is oral health? Is poor health, oral health associated with increased incidence of contracting COVID-19 or its complications?
So, Veena, your oral cavity or the mouth, as we call it, is full of natural bacteria and viruses. Okay. And there are a lot of people who suffer with gum diseases known as periodontitis. And periodontitis is also known to increase the inflammatory markers. So there are chances of the virus and the bacteria even entering your body through your mouth if your oral hygiene is not taken care of. As in, I'm talking about the blood circulation. Of course, the virus does enter your system through the nasal cavity or the mouth. So it's very important to keep your gums and your teeth very, very clean and make sure that your inflammatory markers in the body are not already high due to any periodontal or gum diseases.
And how important is a pre-procedural mouth rinse?
Very important. So we make it a point that we make the patient rinse with hydrogen peroxide or sodium hypochlorite for 30 seconds before we start any dental procedure. That is just taking a precaution, making sure that any virus or bacteria that's pre-existing in the patient's oral cavity is brought down in numbers. We cannot completely eliminate it, but the numbers are definitely brought down by that.
Have you seen any changes in the patient's perspective? Are they comfortable visiting the clinic, or they're very scared? As it is, a dental clinic is a Hawa in everybody's mind. Now with the COVID, it's like very difficult.
Yes, it's very, very difficult on us because the patient is just not comfortable visiting a dentist any longer. Now without your face mask outside your homes, you feel very bare, right? So it's very difficult to remove your face mask in an environment that may be infected by virus. So it is very scary for the patient and the dentist or the people working in a dental clinic likewise. But there are a lot of steps that we are taking to make sure that things are under control. So as of now, there is nothing to worry about.
But earlier on, when we had started with COVID, somewhere midway, there had been a study which said that surprisingly, dentists are not too much exposed, or they haven't got the infection through patient care. Or what could be the reason for that?
That's not true. That's not
That
true. I know of enough colleagues who got infected through the patients.
Hmm.
And the aerosols that we are talking about, every time we use an aerator, the amount of water that is coming out of our aerotors is enough to dilute the kind of viruses that the mouth is producing. So, of course, the environment, even if it is getting infected by the aerosols, we make sure that the air purifiers are on at all times. And that is why we switch our operatories so that we can fumigate the operatory at least for 15 to 20 minutes in between patients.
So, what are the
Yes, but that
dental?
is a fact that, like anybody else, like there were a lot of doctors also who were treating the patients, COVID patients in emergency with all the protocols that they were following. They were contacted COVID-19. It is very true for dentists likewise. There are a lot of dentists who have contacted COVID-19 through the patients.
And are there in any instances in your clinic or any you know of where the patients have got COVID from a visit to the dentist?
So fortunately, no. But we've had, see, there is an incubation period of 4 to 5 days, right, before a patient starts developing symptoms.
Yes.
There was a patient in our clinic who, after the procedure, went home and said that I have fever. So that
Mhm.
definitely could not have been contacted at the clinic.
Yeah,
The
yeah.
patient definitely had COVID-19 before he came to the clinic, but fortunately, none of the staff got COVID-19 from the patient. So our protocols are very strict and very much in place.
Yes, I am witness to that. So,
Yes.
what are the dental or oral manifestations of COVID-19 that you've seen in your practice?
So during COVID-19 per se, there are no symptoms that can develop in the oral cavity that are the first symptoms that will tell you have COVID-19 other than loss of taste. That's the only symptom that you can have within the mouth that will confirm COVID-19 for you. Post COVID, we have seen a lot of things happening in a patient's mouth. Number one, we've seen cracked teeth syndrome, where the teeth have cracked down or broken down. We have seen loosening of teeth. We
Wow.
have also seen cases of mucormycosis and also ischemic osteomyelitis. So there have been patients in my clinic which I have diagnosed with ischemic osteomyelitis. Quite a few cases like that we've come across.
And what about ulcers and on the tongue, on the hard palate? Is that also?
Uh, I'll see post COVID, there have been a few cases where there are ulcers. Pre COVID, we haven't seen any ulceration. Or during COVID, actually, we don't get to see a patient during COVID, thankfully, because we are very strict with temperature recording or SpO2 level recording. So, luckily, I haven't seen but one case in our clinic that was seen during the patient showing symptoms of COVID. But as such, no patient walks into the clinic with oral ulceration during COVID. So most
Oh,
probably all these symptoms are happening after COVID, post COVID.
yeah. So, but your people who come to you for dental treatment, and if they've had COVID, do they report that they've had ulcers and because of COVID? So, apart from these the three, four things that you have said as what you have observed, are there any other documented symptoms that people should be aware of that could lead, especially of the oral cavity, that could lead them to think that they might have COVID?
So, okay, ulcerations, like you mentioned, one of them is ulcerations. The other is any black patch on the palate or on the gums. The black patch could also mean that there is mucormycosis that is starting in the sinuses and has trickled down into the oral cavity. Loosening of the teeth, any pus discharge from your gums. So a lot of people have come back and said, we have pimple and we can feel a bad taste in the mouth. There's discharge of pus in the mouth. So all of that are a few symptoms that you need to keep a lookout for.
So, after a person has recovered from COVID-19 episode, how long after do you advise them to visit you for a dental checkup if they are
At
in
least
need
two
of
weeks. At least
2
2
weeks?
weeks.
Okay. So do you
And
ask
after
them?
2 weeks, we only see emergency patients. We are only doing palliative treatment. We are only relieving pain with medication. Any kind of surgical procedure, we like to defer for at least a month, month and a half. And suppose it's a wisdom tooth extraction, or if it is an implantology or bone grafting, we like to defer it for at least 3 months.
Right. And do you insist on a RT-PCR negative before they come to show you? Or
Absolutely. Absolutely. So,
okay.
people who we feel, or, especially during the April and May session, where the second wave was really high on the rise, we actually shut down the clinic for 2 months. And post that, when we started seeing patients in June, we would ask them to get an RT-PCR done. And now we are okay just taking temperature and SpO2, checking the SpO2 levels of every patient who walks into the clinic, taking a history of the patient, whether the patient has been COVID positive or not, asking the patients whether they have been vaccinated or not been vaccinated, and then letting them enter the clinic. So if we ever doubt that a patient is, could be exposed, is going out a lot, has just come back from a travel or something, then we ask for an RT-PCR test.
So is implant failure a common concern in patients who had COVID?
Not as of now. No, because see, most of the patients, in fact, we had a few cases which we did implants on, and they had COVID immediately after the implantology procedure, maybe let's say 2 to 3 weeks down. But the implants did pretty well. We had no problem with the osseointegration of the implants. No.
So how has have you been doing teleconsultation during the pandemic? Is it a successful
Yes.
model for practice? Considering
So teleconsultation, yes, we've been doing a lot of teleconsultations, but I would not say it's a successful model at all. A particular pain in the dental mouth could be caused due to various reasons. So, if I just put the patient on antibiotics or painkillers, I'm not sure whether the antibiotic I'm using is the right antibiotic for the pain, right? It could be either a dental issue or it could be a gum issue. Now, the antibiotic for a dental issue or a tooth issue is very different from an antibiotic from a gum issue. So I could be prescribing a wrong antibiotic to the patient, because in dentistry, it's very important for us to see the patient and to diagnose the patient before we can actually give them any medication. So according to me, it wasn't successful at all.
so, and what about patients who were needing emergency medical care, dental care during the lockdown? How were you managing those?
We were seeing patients. We would ask them for an RT-PCR. Before they would enter the clinic, they would be asked to wear a surgical gown, head caps, shoe covers. We were wearing respirators. We were wearing N95 masks. We were wearing shields. We were making sure that there were only emergency patients that were entering the clinic. So we were not entertaining everybody and anybody. And we were being careful as we could be.
So, who are the patients who could be managed? Even now, the practice of medicine is changed with teleconsultation, and we've realized that not everybody needs to go to the hospital to physically visit the doctor. So, in
Right.
like dermatology, it's a very successful model. So, in your case, which are the cases which would be ideal for teleconsultation, and you would advise them to do that rather than coming in person?
Uh, I can't really think of a case, because see, if suppose you have pain, dental pain, right? Like I told you, the pain could be either there's an abscess in the tooth or there is an infection in the gum. Now, I could give you antibiotics and painkillers, but that is just a symptomatic treatment. It is not really a treatment. A dental infection cannot be treated till a root canal is not done, or till the tooth is not extracted, or the gums are not cleaned. So for dentistry, it's not such a great idea. You
And
have to see a patient.
what about people who have corrective treatment going on? Even they
So
can't really.
orthodontics can definitely wait. But what has happened is, in these 2 years, we usually complete orthodontics in 2 years for a child. That has stretched on to 4 years, or, something like that, because kids who are trying to complete the orthodontic treatment could not be seen during these 2 years. So the treatment became much longer. Not that it did any harm, but it's just that you go back to ground zero. You have to restart afresh whenever you see the child again.
So,
So just take that.
whenever I've come to your clinic and needed an X-ray, you put something in the sensor in my mouth and take it, and there are
Right.
images that can be done externally also. So, what are you preferring now? An extraoral or an intraoral imaging?
See, each image has its own advantages, right? Now, suppose I were to be given an option, I would first do an extraoral because that's much simpler. I can see the entire oral cavity in one image. I don't need to keep taking little images and multiple images at one time. But when I want to confirm something, then I do need to take those IOPO x-rays. But yes, my preference would first be the extraoral imaging and then the intraoral imaging now.
Let me see. I think I see some questions. If we can take a few questions, if they're related to dentistry. Uh, Keshav Karmakar says 95% of one wisdom teeth of 63-year-old male has fallen off. 5% in gingival bed, occasional mild pain. I'm afraid. How to delay visit to the dentist or any other advice, please?
So, see, if the pain is there, it means that there is already infection and that tooth will need to be removed. Right now, the cases of COVID infection are very low. So, this is a good time to take the patient to the dentist and get the needful done. I would not think that you should delay it at this given point in time. Because how many antibiotics would you give the patient or how many painkillers would you give a patient? I don't think that is safe anymore either.
So, if you were to give, in a nutshell, if you were to give out some advice to the patients who are coming in for a dental consultation, what would that be?
Number one, look for a dental clinic that is not a multi-practitioner dental clinic. You must now start going to dental clinics that are smaller and have lesser doctors in them. You must please visit the dentist on time because if you get delayed, the patient who is behind you get delayed and then you come in contact with another human being which you can easily avoid. Make sure that your dental practitioner is taking enough measures for cleanliness and enough measures to make sure that he can combat the COVID-19 infection to his or her best interest. Um, if you can avoid going to a dentist, please do avoid. But as of now, this is a good time to finish your dental treatment because the number of COVID cases are very low at this given point in time. Make sure that you're vaccinated because that is the only surety as of now that even if you get COVID infection, there are chances that you can recover at home and do not need to be hospitalized. See, nobody can take a surety that you cannot come back or you cannot get COVID infection the moment you step out of your house. You just need to be very careful. But I request everybody, please stop wearing gloves and coming into dental clinics because you are touching various surfaces. And the worst is then you pick up your phone and you touch the phone with the same glove that you're touching the various surfaces with. I have noticed that when a patient is not wearing gloves, he will sanitize his or her hands multiple times. So before he touches his phone, before he gets up from the dental, after he gets up from the dental chair, before he's entering the dental clinic, after he's exited the dental clinic, he sanitizes his hands. But the moment his gloves are on, he forgets all of that. So he's touching the gloves with dirt, he's touching his phone with dirty gloves, and that's enough. Even if you remove the glove later on, the infection is already there on your phone. So please avoid over accessorizing yourself when you go to a dental clinic. Let the dentist or the dental clinic handle that for you.
Another practical question: How can a toothbrush, and brushing spread COVID? Should toothbrushes be changed often? How often should the toothbrush be changed?
See, if you are to get COVID, you can just touch a surface and you can get it, right? You just need to touch the handle that somebody before you, he sneezed into his hand, has touched, and you need to just touch your nose to get COVID. If you are the only one using your dental toothbrush, I don't see any sense in getting COVID out of that. I don't think so. So unless and until you're sleeping with the partner in the same room, a toothbrush has no role to play. No.
Mm.
Understand one thing. They say if you wash your hands for 20 seconds, you're making sure that the viruses in your hands are killed. It's the same with your toothbrush. The moment you have the toothpaste onto your toothbrush and you're brushing your teeth, you brush for at least 20 seconds. So there is no way, according to my sensibilities, that you can get COVID infection through a toothbrush.
Okay. So there's another question. हिंदी में है, थोड़ा सा पढ़ने में मुझे टाइम लग रहा है. नमस्ते डॉक्टर राधिका, दिस इज केदार जोशी जी. मुझे डेंटल पॉकेट के कारण एक दांत उखाड़ना पड़ा, लेकिन वह पॉकेट बगल के दांत में ट्रांसफर हो गया है और अब दांत के नीचे जड़ तक चला गया है. दांत सही हालत में है, अब इसका क्या इलाज हो सकता
जोशी जी, ये इस डिजीज को हम पेरियोडोंटाइटिस या पायरिया बोलते हैं. ये सिर्फ एक दांत तक सीमित नहीं रहता है, ये एक दांत से दूसरे दांत तक बड़ी जल्दी फैलता है. इसका बेस्ट इलाज होता है कि आप डेंटिस्ट के पास जाइए और वो डीप पॉकेट डिब्राइमेंट करते हैं. वो अच्छी तरह से नीचे जाके, मसूड़ों के नीचे जाके दांतों की सफाई करते हैं और लेजर ट्रीटमेंट से या फ्लैप सर्जरी से वो लोग दांत साफ करने की कोशिश करते हैं. तो अगर आपको पायरिया है, ये बहुत इंपॉर्टेंट है कि आप एक डेंटिस्ट के पास जाएं और अच्छी तरीके से अपने मसूड़ों की और दांतों की सफाई करवाएं.
So, what is the related to this? What is the reason for gum disease? Is it inadequate brushing? Is it what is the?
So first, to begin with, it is known to be hereditary. So, like I told you, there are bacteria that are normally living in the mouth. So, a few of us have bacteria that cause gum diseases that pre-exist in our mouth. So, if suppose you notice your father or your mother lost the teeth very early, and unfortunately you inherit it from them, you will also get this disease and you will lose your teeth very early in your life. The best way to maintain your teeth is regular cleaning through a dentist. Don't try and brush, because there is no way that you can brush away those bacteria that are stuck onto your teeth with a toothbrush.
Right.
So it is genetically linked a lot of times.
But also a regular dental checkup goes a long way in keeping your teeth healthy.
A very long way. A regular dental checkup goes a very long way in maintaining your dental hygiene and your teeth.
And one last question. Is there any particular preference for a toothpaste, with all these expensive Sensodynes and Colgate Sensitives and Colgate Blue and gel and all that? So there's a lot of confusion and lots of products.
Sensodyne is actually a medicated toothpaste. We like to prescribe it to a patient who's having sensitivity due to A reason or B reason, right? It is not a toothpaste that a person should go and pick up off the shelf and use it on his own. So unless and until you're prescribed to use a Sensodyne, please do not use it. A regular toothpaste is good enough. Now, what is important is never the toothpaste. It is always the toothbrush. Make sure that your toothbrush is soft so that you can brush the area around your gums and they do not harm your gums. Make sure that you brush all the areas with enough concentration on the teeth at the back, because most of the times you're so busy making sure that your smile is shining, you forget to brush the teeth at the back. So brushing is a more important action as compared to a tooth. पहले ज़माने में people used दातुन, right? And they had very good set of teeth. Now, दातुन did not involve any kind of a toothpaste. It was just a neem stick that was bitten into to form a toothbrush and massage the gums and teeth. And those people kept the teeth for a very long period of time. So hence, please do not concentrate on a toothpaste. Any normal, non-medicated toothpaste off the shelf is a good option. Another toothpaste that I don't like patients using are gels with these little particles in it. These particles act as sandpapers. So rather than brightening your teeth or making them white, they're actually taking away enamel, which is a very important protective layer of your teeth away from your teeth, causing sensitivity. So any regular toothpaste like a Colgate or a Cibaca or a Anything that you like is absolutely fine with me. Powder should be avoided, gels should be avoided, anything with particles should be avoided, and anything that has medication in it, unless and until prescribed to you by a dentist, should be absolutely avoided.
I just thought of another question that I would like to know the viewers the answer for. What about teeth
Sure.
grinding? What about teeth grinding?
So, actually, when we say a broken or a fractured tooth syndrome, it is all caused due to stress, right? And as we age, what we have noticed is that a person, as he ages, starts grinding his or her teeth even more. I'm not saying that it's age related, because we have seen grinding in children as young as 6 to 7 years, okay, and very loud grinding. So it is actually a central nervous system problem. It is not something that the person does it on purpose. It's not in your hands. It is a central nervous system issue wherein you're grinding your teeth to release stresses. So you usually see this kind of teeth grinding more in type A personalities, where people are very perfect and want everything to be done correctly. It's very important to wear night guards or guards that will protect your teeth against grinding each other down, because due to excessive grinding, you can actually fracture your natural teeth. So it is a good idea to see your dentist and to get a night guard to protect yourself against excessive grinding.
I see somebody nursing core asking one question. Good evening, ma'am.
Sure.
How frequently can we use chlorhexidine mouthwash, and what is the correct way to use it?
So I do not like anybody using mouthwashes without a prescription again. So whenever I prescribe my patient a chlorhexidine mouthwash, it's either after a surgery, whether it's a gum surgery or an implant surgery or a wisdom tooth extraction surgery. That's when I tell a patient to use a chlorhexidine mouthwash. See, there are always advantages and disadvantages to anything. So, pros and cons, even to eating vitamins, right? Excess of vitamins also cause harm to a human body. Similarly, excess rinsing with any kind is very harmful for your mucosa, because your mucosa is very thin and sensitive. It's not like your skin. So please do not use it till you are not prescribed. It should not be a regular feature or a regular bottle that you have in your bathroom and something that you're doing on everyday basis. No.
But but that's what's been going on in COVID, right? Everybody has been told to do gargles. Uh, and
But there are a lot of, I have to share this with you. Of late, I have seen at least 3 cases of Candida, okay, which
uh,
is a local fungal infection in the mouth in patients who have not had COVID. So the only explanation that I can think of, and whilst I was talking to these patients, is that they are overdoing their mouthwash. See, when we say there are bacteria in your mouth, there are good bacteria and bad bacteria, just like your gut. One of the function of the bacteria is to restrain or keep the fungal infection in control. So if you are going to kill the bacteria and viruses that are present in the mouth, it is going to lead to candida infection in your mouth. So please do not do it as a regular habit. Please do not do it. If you really feel like something, use warm saline rinsing. Lukewarm water, salt, and gargle with lukewarm water. That's about it. It's been, I don't know, people are doing it out of habit. They're having turmeric out of habit. They're having giloy out of habit. There are a lot of cases that I've seen which have had reactions to turmeric and giloy even. So please do not make it a habit. Everything needs a break. You want to do it for a week. Give it a break for 10 days, 15 days. And let me tell you, even if you regularly use chlorhexidine, if you come across a viral infection or COVID-19, it's not going to stop it, because it doesn't go in just through your mouth. It is going in even through your nasal cavity, and there is no control over it. So kindly do not use chlorhexidine mouthwash as a regular thing in your daily lives.
thank you,
I know the
Radhika.
doctors are prescribing it, but I'm strictly against it.
So thank you, Dr. Radhika, for joining us today. And as a token of appreciation, would like to give you a certificate. Ritu, Manmeet, who is there today. Can we have a certificate, please?
Thank you so much, Dr. Veena. It is always a pleasure. Thank you.
All
Thank
right.
you so much.
So, sound knowledge of the spread of SARS CoV 2 is required to prevent its transmission in the dental practice. Aerosols are a predominant route for transmission of pathogens, including SARS CoV 2. Therefore, stringent infection control measures are imperative. The specific recommendations for dental practice are required for patient screening and infection control strategies. Dentists must abide by the most recent recommendations from international, centralized, and local public health authorities. Telescreening, teletriage, and teleconsulting is highly recommended where possible, and even the report sharing can be done through that. A detailed medical history regarding the symptoms of COVID 19 must be investigated, and in case of any positive replies, in office dental care should be delayed for 3 weeks, except in cases of dental emergencies. If needed, patients can be prescribed analgesics or topical agents via a teledentistry appointment itself. Appointments should be staggered, as Dr. Radhika said. An accompanied person should not be encouraged except for children or people with special needs. Before allowing any patient into the dental office, his or her temperature must be recorded. Hand sanitizer and mask should be made available for patients in attendance. I have been to Dr. Radhika's clinic. All this is done along with a gown. Pre-procedural mouth rinse with oxidative agents such as 1% hydrogen peroxide or 1% povidone iodine is considered to minimize the viral load, thus helping in the reduction of aerosols and salivary pathogens. So stay safe, but do not ignore your dental problems due to the fear of catching this virus. That will be all for today. We will be back tomorrow at 7 p.m. with another edition of the show. Keep watching Dr. KK's MEDTalks. Namaskar.